So this is Group 6 EHR. When you open up the tables here, you have an options for TB patient and TB, the table for patient education and prescription, and then one for the visit. So if you click on this TB patient option, it will give you, which we have now, which is this main screen. It will provide you information on the patient's name, full name, their social security, their address, and of course their insurance information. If you scroll over here at the bottom, it will also give you information on their immunization status. So if you look over to the left-hand side again, the education will provide you the diagnosis that we have for the patients and our associated education notes. Under the prescription, also have prescription information too for each of our patients here. That includes the name of the prescription, the drug name, if the generic option is allowed, pharmacy information, and of course it has the name of the physician that ordered the prescription. Under the TB visit, it also has the patient's visitation notes and visitation dates and the main complaints that they checked in with. So for our CDS, so that our EHR is meeting the requirements for meaningful use, we have 5 CDS that we created. The first one is going to be an alert that gives us if the patient is not up to date under immunization. So under the patient form, there's a tab that says immunization here. And then there's a drop box that says the patient is flu vaccine received. It will not give you an alert. So similarly so for the pneumonia vaccine received, it will not give you a check alert message. Now, if the patient does not prefer to say, or they're not immunized, that's what we created the code for. If you do the check alerts, it's going to give you a message that says patient needs to complete immunization flow sheet. Now, our next CDS will be under the visit form that provides information if the patient has any symptoms of shortness of breath that they need to be screened. So asthma falls in that category. So if you come in with a complaint of asthma, you will receive a message under the check alerts that says that they have an asthma issue. They need to be screened for possible shortness of breath symptoms. Same as if they do, the other one, our other diagnosis that we have an order set for will be back pain. So for back pain, if you hit the check alerts, it will give you a message that the patient has back pains and will need options for therapy. Our 4th CDS protocol would be a patient complaining of a fever. I think that's at the very lowest here. Let's see if I can bring this all the way down. Let me see if I can type that in. Make it easier. There we go. So fever. If you do the check alerts, it's going to give you a message that you need to screen for possible sepsis. Since sepsis has high incidence of death, that will make sure that the patient is seen and appropriate measures are done. And our last CDS that we created is for the drug-to-drug interaction and also for any allergies that the patient may have. So under the visit form, it will have an option for you to say known allergy or no known allergy. So if you click no known allergy, but you're under fever, the only message that you receive will be for the possible sepsis. And then if you do decide that the patient doesn't have any allergy, or does have an allergy, known allergy, if you hit the check alerts, it's going to tell you to make sure that you review the prescriptions prior to sending it because of known allergies. So currently, the 5 CDS that we have on our EHR will be drug-to-drug interaction for the allergies, protocols for back pain, asthma, and fever for rule out sepsis. And then the last one will be under the patient form to make number 5, under immunization, to check if they're immunized for the flu or up to date under pneumonia shot. And if they're not, like I said, it's going to give you an alert that lets you know that they need to fill out the immunization flow sheet. Thank you.